Well, hello again, everybody. This is going to be a little show and tell video. Not going to be a repair video because this device you have in front of you here really isn't user repairable. It's a sealed unit, but it's should be enough to demonstrate the concept. What you have in front of you here is a medical grade diagnostic ultrasound unit. Much like you'd find in a hospital. And this particular one is a portable ultrasound unit, and it's used for multiple purposes. You can scan the abdominal area, you can scan your carotid artery with this, you can do musculoskeletal studies with it. You can do, all kinds of different things. This is a pretty versatile little machine for being so small. And I guess the reason I wanted to show this is just a lot of people have never really gotten a chance to see medical equipment like this up close unless that's being used on them. And then you really don't get to see much. So I thought maybe I'd take some time just for fun to explain what an ultrasound is and a little bit of theory of how it works. Now this one here, as you can see, is very compact. And you can see that it's, nothing to it. It's the size of a tablet, pretty much. Now, original ultrasound units, the first ones that came out, were very large. I mean, we're talking the size of a washing machine or even bigger. And they only could do black and white. And the first ones could really only do like one line. And they would actually, to view the Doppler effect or to measure flow, of, for instance, blood through a vessel. We've come a long way since then, big time. And so what these things can do today is they can actually make an image of your internal organs. And the beauty of this is how it does it. Now, as I've talked about on this channel a lot of times, I work also with X-ray. And X-ray is kind of a destructive thing in that we're producing ionizing radiation. And ionizing radiation, whether you don't know it or not, I'm sure you do, anytime ionizing radiation interacts with our tissue, our skin, okay, it damages that tissue, okay, and it can even cause cancer. I'm going to do a video, a series on radiation in the near future explaining this, and this is kind of going to be an introduction to it. What ultrasound uses is something different. It's ultrasonic radiation is what we call it, or really it's kind of just glorified sound waves, okay? But these sound waves are much higher frequency than our ears can hear. They're in the radio frequency range, but that's not radio frequency. As a matter of fact, here is a transducer. Let me get down here. This would be an ultrasonic transducer. And you can see the ultrasound would actually propagate out of this little window. We call this the window. And inside here is a piezoelectric crystal. And the piezoelectric effect is when we apply a certain voltage to that crystal, we can make it vibrate. And we vibrate it at a very high frequency. This one in particular vibrates at up to 7.5 megahertz. So 7.5 megahertz, any of you ham radio operators can know what band that's in, but that's higher than the AM radio band, but lower than FM radio. But it is radio frequency. However, this is not an electromagnetic wave that comes out of here. Okay, so it's not even RF as per se, even though it's in the frequency range of what we call radio wave or RF. But it's actually sound pressure. And because of that, ultrasound needs to have a medium to propagate through. Now, what do I mean by that? Well, what that means is in order for this to work, it has to have some medium to vibrate through, to propagate through. Whereas radio waves or electromagnetic waves can travel even in a vacuum. So that's why radio waves can travel through space. Okay, even though space is a vacuum, electromagnetic waves will travel through it. If we took this into outer space and turned it on, nothing would happen. Nothing would come out of it because you need a medium for it to propagate through. And it's so much so that even air is a very poor conductor of ultrasonic frequency. So you even need something closer to water. Water is a very good propagator of ultrasound. So that's why, if you ever notice, they actually put that gel on you before they put the probe on. And the reason that they do that is because that gel actually sonically couples the window of this crystal to the body part that you're trying to image. Okay, I hope that makes sense. So if we don't use that, it's not going to work. Now, if you notice, the connector on one of these has an awful lot of pins. I don't know if you can see all those pins in there, but those pins represent all of the channels that are in here. These crystals are actually scored into many, many different sections. And those sections actually each vibrate independently, and they can receive the information. In other words, they vibrate and give off a sound wave. The sound wave will then reflect off of an object and reflect back and vibrate those crystals. Those crystals will then, since they're piezoelectric, the vibration of those will create a very small current, and that current goes through these little pins, goes into this ultrasound unit, goes through a preamp and gets amplified, and then it goes through what's called beam forming, where all those little individual channels will get put together into a two-dimensional black and white image. And through computer software, we can even add color, and we'll see what that looks like here in a little bit. So let's turn this thing on. And I'm sorry, because this is a real bright glossy screen on this particular model, so it's really hard to get an angle that it's not so reflective that you can't see it. But we'll try to do our best. But let's turn this thing on. We first have to plug the probe back in, and we'll turn the unit on. There we go. And we'll watch it boot up. And it's just like, it has software, it has an actual computer in it, and a hard drive in here, and it actually has to boot up just like any other computer boots up. Okay, let's move this around here maybe, and we can watch it boot up. Okay, so it's all booted up. So you can see in here that right now there's a whole bunch of controls. Now in the old days, the early unit, this is a touchscreen ultrasound unit, which is a relatively new thing, believe it or not. They've had touchscreens on ultrasound units for quite some time, but the touchscreen was just for the controls only. This unit has no buttons on it. All of these would have been buttons and knobs, and they still are on the larger units. But for these little portable units, we're now seeing these units that are actually touchscreen. And it's pretty neat, because you can go in and change everything by touching it. And, So let me explain a few things here, what you're looking at. Right now, what you're looking at up here, this area is the image area. This image around here is the control area. And what you're seeing right now, these are called your TGCs. So remember, I told you that when the sound comes out of this crystal, reflects off of an object, comes back, and then causes a little current in here that's picked up and amplified. Well, these TGCs are actually little zones for how far away. So up here represents the actual transducer itself, and down here represents about this far away from the transducer. And each one of these adjusters is like a brightness control for these little focal zones. So if I turn this one up, you can see I'm brightening that area at the top. If I turn this one up, it brightens the area at the bottom, and so forth. So we can use that to fine-tune the image once you get an image on there. All right. Now there's lots and lots of different things that an ultrasound unit can do. As you can see, like a biopsy, for placing a needle. Like if you wanted to place a needle somewhere to extract a biopsy sample, a core sample, to send to pathology and have it tested. This machine can actually help guide the needle in for the doctor, so he can actually see where the needle is being placed. Okay. Let's do a little study here. Okay. So we'll enter in the patient. There we go. And hit mail. And that's really should be all we need. And application. Oh, sorry. Let's get back to here. And it should be just about ready to go here now. If we look, you can see my hand, where my finger going across there. If I put my hand on here right now, it does very little. You can see I'm not getting anything. And the reason being for that is because it's not coupling very well to my skin. Okay, so let's take some gel and put on there and see what happens. So let's take a look at how one of these things work. And I'm probably not going to get a really good view, simply because, hold on, let me get my microphone adjusted here, simply because I don't have an actual tube of ultrasound gel, but I do have some aloe vera gel, which is similar. It's very important to be able to couple the sound or the ultrasound waves to the object that you're imaging. And to give you an example of how that works, you can see how dead the image is right now. There's nothing in there. But watch what happens when I put gel on here. Magically, the image fills up. And what you're seeing is the reflection of those ultrasound waves off of that gel. Now I'm running right now at about 6 megahertz. Okay, is what the transducer's doing. And I'm going to see if I can show you a picture of my carotid artery in my neck. Now the carotid artery is the artery that runs down the left side of your neck, from your kind of up by where your left ear is, down kind of through your shoulder area and into your heart. Okay, so it's a pretty major artery. So we should be able to see it. It's probably going to be a little bit difficult because of the gel not being the correct kind. But let's see if we can see it here. You just barely start to see it right here. Okay. And let me move the gain down a little bit. Okay, there it is. See it? Right there, that hole. That's a cross section of the carotid. And let's see if we can get it to open up and look inside. Wow, I'm not getting a good view. Here we go. There it is. See it? Now let's go into color mode. And you can see as my heart's pumping, I'm having a hard time holding it and talking. And you can see there it is. There. Now the blue indicates the direction that the blood is flowing through the artery. If it were flowing the other way, it would be red. See how when I talk there's some red because there's some waves moving the other direction? Now, what's the purpose of that? Well, if my carotid artery were blocked, let's say I was having a heart attack or a stroke, you would actually see little red swirls, little red, your heart would beat, it would pump, you'd see the blue, and then as it would reverse because it's being blocked, it would try to flow back into the heart, and you would see a red color, or even a yellow color if it's really intensely moving the other way. So this is how we can check people for for blockages in their arteries, and we can do it in a non-invasive way without exposing them to ionizing radiation. Okay, and that's really important because once again, this is a way that we can check patients without exposing them to radiation. Now once again, ionizing radiation is a bad thing because anytime it interacts with your tissue, it damages the tissue. And 99% of the damage done to the tissue by the ionizing radiation, your body will heal from, but 1% you'll carry for the rest of your life. It's permanent damage. And every time you're exposed to ionizing radiation, there's a probability that, even though it's very slight, that a cell could mutate and even turn cancerous. So ultrasound doesn't have any of those effects, okay? Because it's sound waves. And once again, like I said, this will not propagate in a vacuum. So if we took this into outer space, you would not get any, it wouldn't be able to propagate through a vacuum. It has to have a medium to travel through. That's why we had to put the gel onto the probe to be able to couple it to anything, to be able to see anything. If I place this on my neck right now, see how hard it is to see anything? You can't see anything, okay? But if I put that gel on there, it gets really clear, okay? And that's why they do that, all right? So this is just a very basic little show and tell of an ultrasound unit. There's a lot of other features that these things can do, but I don't really want to get into that because I think that would get a little too complicated for this. But I just thought this short little video would kind of be a primer to different types of radiation. This would be an introduction to sonic radiation, which is not electromagnetic, so it's not the same as a radio wave, it's not the same as an X-ray, it's not the same as gamma rays, but it's sound waves. In other words, you're moving the air, or whatever medium it is, you're vibrating it at, in this case, 7.5 million times per second. Okay, and we're using that sound wave, and of course, when the effect of a sound wave going out, echoing off of something and returning, we refer to as the Doppler effect. Okay, so it's very similar to what's used in radar. So any of you military people who have worked with sonar, that's really close to sonar in the Navy, and it's also very similar to radar. But radar, of course, uses RF. Sonar uses sound waves. Okay, so You know, when you hear that sound of the submarine, you know, making that pong sound, you know, that's sonar. And that's the same thing as what this thing's doing, okay? Sonar only thing is it'll travel miles or a mile, and you know, ultrasound will only travel short distances, you know, less than a foot. So I don't know, I hope this was interesting for you to see. I just had the thing here. This is a new unit, and I just thought I'd kind of show it to everybody before I took it out. So really nothing other than that, just a little show and tell. If you're interested in knowing more about ultrasound, let me know in the comments, and maybe I'll do something a little more in depth than this. But I just thought I'd take a short time and kind of show you what one was and how they work.